Hi class, welcome to Module 10. This is the last module for the class. And again, a 2-week. We'll start with Chapter 10 and then we'll do a wrap-up in this second week. But they're both being put together here. So we return to the definition of family, how we defined it for the implications for service and relationship is different than how we've defined it in sociology. But we're also looking at families changing over time. This chapter really explores the U.S. policy, including welfare policies for family, young and old, and the social inequality influenced by race and ethnicity and gender issues. Still a high concern, which we talked about in family work. So some significant issues as you move forward. So let's look at the PowerPoints. So we're back to the first chapter, the 4 approaches of defining family, by structure, by household, by roles, and by interactions. Now, government looks at family very much by that structure put into place, that law component, and it's pretty substantial as we start defining our approaches to family. As we look at family, we look at those particular issues that pop out related to diversity, inequality, and social policy. Sociology especially is always focused on these issues of inequality that comes across through sex and race and gender and social economic standing. And we can see that there's some significant differences in our country in how we address families. There are housing policies and inequalities. So there's the public benefit for home ownership. So people who are poorer or live in major cities where they couldn't own are disadvantaged by this. We see significant issues related to wealth accumulation, that there are advantages within that, and that power can ride within the system. You notice how we're already looking at some of those theories we've talked about before. And we can see that welfare policies with inequity or inequality, the United States has very weak a welfare state. We think of ourselves as highly a welfare state and significant in the process of who gets welfare. But we really have this deserving and undeserving poor, that we believe that disadvantaged or people haven't worked hard enough to get there. There's a belief in the United States that we can pull ourselves up by our own bootstraps, and we say that. And what the reality of it is that people born in lower class and poor families will remain in lower class and poor families, not because they don't work hard, but because opportunities aren't necessarily given to them. And we can see part of that. That's part of what you're going to be observing within your videos in the module this week. So there's an expansion for support of some groups and restrictions for others. And so we're going to look a little bit about some of that family policy. So some of this information is beyond what you have in the textbook, just or put into different meanings. So family policy is a selective approach to benefits as far as what we've seen in place. And selective programs for which only a few or a select group of people is eligible. So we see these coming into place based on who you are, who are you to find out where you live, and eligibility can be very, very localized. And then we also have means test programs for some which benefit the needs to meet some eligibility requirement to come into place in family policy. Those type of programs like Head Start, insurance programs, we see are very much part of the social system. That not everyone qualifies for health care, but if we're poor enough, then we can get some form of health care into place. This is part of the argument that you're facing right now as we look at the change in the healthcare policies. So family policies. A universal approach to benefits is when we have that universal plan, everyone qualifies. The universal programs help strengthen all families regardless of their eligibility. In other words, we can have a child care center that would be open for everyone, or after school center, and everyone would qualify just based on the general statement that they needed that service, instead of saying who's got the money and who doesn't have the money. And we see changes as well. As we have this universal approach to families as far as progressive taxation. That's a tax system under which those who earn more pay a higher percentage. That's not what occurs in our country. That's pretty significant as we look at that within the process. Okay, in other countries, we have built the resilience of families. So we talk about resilience in this chapter, how well families do that. They are resilient, and even through disadvantage, they rise. But National Health Insurance really considers the health care for all citizens, and that health care is a public right. That is not the process here in the United States. That healthcare is a public right. It is a different perspective within that. And we have mandated through the Affordable Care Act that everyone has to have insurance. Important issue for the family here. We have the highest rate of insured people now in this country, with less than 10% not having insurance. That means they have some form of health care. But again, without a national health care insurance, everyone's plan is different, and what is covered and what isn't is pretty substantial as we start to consider what's in place. Other things that build resilience in a family are maternity and family leave with paid guaranteed work so that they can take care of their child at home. In the United States, we have no guaranteed maternity leave. Most employers will give you time off based on what the doctor says for a vaginal birth, about 4 weeks, and that would be taken out of your sick time. A cesarean birth, 6 weeks, even less in this day and age. Family Leave Act, however, we have moved forward, and it has come into place, which basically states that a family member can take time off without losing their job to care for someone. And this could be a parent, a spouse, a child. And if we can justify their medical needs. What's interesting, though, with our family leave, and this was signed under the Clinton administration, our family leave is just like maternity leave. There is no guaranteed pay as there are in other countries. So looking at some of the differences in these healthcare systems or in the welfare systems, it's important to look at what's different. So for every 100 live births, 17 women die in the United States. Look at the general population. It's a far cry from Sierra Leone, but it's 8 times higher than Sweden. And we see that our rates of death in that live birth category is pretty significant that comes into place. We are not a country that provides a significant amount of health care into place. So if we look at the United States compared to every other country listed, and we look at the length of maternity leave, then where's the United States? The length of maternity leave. Okay, and the percentage of wages paid. Okay, so the average length of maternity leave available based on your employer, 12 weeks, and the percentage of wages paid. We are absolute zero. No requirement to pay those wages. Again, pretty important as we start looking at the welfare systems. So there's changes throughout the workplace that have made life a little better, such as flex time and flex place and telecommuting. These allow some flexibility within the workplace that allow for time off to care for the family and meet the family needs. high recommendations of policies that should be available into place according to those that study families. Now, think about what it affects the employer. It's interesting as we start thinking about that the minimum wage rates are important because 71% of those directly affected by minimum wage increase are ages 20 and over. So it's not those brand new employees out there. It is the generalized population. And as we look at this, we can see that there are significant differences as far as the number of workers for male that fall in that category of minimum wage versus females at a higher rate. We start seeing these differences into place. The difference here as far as their status as married and unmarried parents, and the process that comes into place. So policies and programs out there have looked at the living wage and what needs to be in place. And we do that pretty much by looking at minimum wage. But we've also looked at the earned income tax credit, just so you have some information on that. This is a welfare program as well. It's defined as the refundable federal tax credit for low income family, and it reduces the amount of tax that they would owe. So this is a benefit that comes into place. Then we have welfare. And currently our welfare system is temporary assistance for needy families. Now, your book goes into a great detail of talking about when the history of the welfare program. It started basically in 1935 as we start with the Social Security Act, which gives us that base level to provide people with retirement income that have been working. We say that 65 is aging in the process. We see that we believe in this welfare state, and at that point we start adding to disability, and under that plan comes a program called ADC, Aid for Dependent Children. Aid for Dependent Children services each state. Each state had a control that they could determine what the needs were of a family. As I was working for the Department of Human Services in Ohio, a family of two during the 1980s would get about $212 a month. However, if you were living in Alabama at the same time, you would only get about $78 a month. So that the states controlled that within the process. Now, there was this belief that everyone was on the take in the welfare system. Pretty powerful as we start to look at what that need was. And in the welfare system, we move from ADC and general relief, which are eliminated. We move from that and eliminate it. And with that, we lose almost 50% of the people off the welfare rolls that just disappear. And temporary assistance for needy families changes with this requirement of work and involvement. The TANFs resulted in this dramatic reduction in the number of families receiving cash benefits. And that has been really limiting who can get help and how long they can get help. Now again, most of the concern about welfare was the welfare mamas. Yeah, less than 5% of the people collecting welfare. The majority of people who were on welfare, especially ADC, were on for short time periods to get themselves stabilized, to get them back into the workforce, and to affect them. You're going to find that I'm asking you to watch one video for this chapter. Just one, very short. And it's the history of the Black welfare mama, the real rise of that myth. So a very short look at it. And I think that you will be surprised at how we turned a myth into a belief for a whole country. pretty powerful when we start thinking about the numbers that come into place. So currently, TANF is the principal cash welfare program in the United States, and it will help families get by. It is a short-term program with limitations on it. Then we have other welfare programs, including early childhood intervention programs, and we have state children insurance programs. In Pennsylvania, we call it CHIP. In New York, they called it other names within that, and each state had the ability to control that. It is supported through Medicaid dollars, so there is an income requirement that comes into place. With the inaction of the Affordable Care Act, then more people had insurance, but then children were still eligible for this support. Other social welfare that comes into place are tied to child support and child care policies. Important for things for us to consider. The United States has some of the poorest child care policies, and there is very little assistance for working parents unless you reach that means test level. So something to consider as you're looking through this chapter. Our book gives us some idea, but I wanted to share a few more things with you. Despite the programs that help uninsured children, many remain uninsured. And this is really important. Now notice this is before the Affordable Care Act, but it's still children that are the most likely to be without insurance. Pretty powerful as we start thinking of that. And then we see this 6 million custodial parents have no child care agreement from their spouse as far as child support, so that they may be entirely on their own. And why they don't have this support, they did not feel they needed a legal involvement. They didn't want the other parent to pay. They couldn't locate the missing parent. All of these things come into play, and they're pretty powerful in affecting the welfare of children across our country. So big issues within that. So there's an accumulated advantage and disadvantage in life, and we can see it especially in families. So Social Security as in security, and economic well-being make a difference, and these health policies are pretty powerful as we come into play. Along with this, we're looking at the economic inequality. Yes. And the growing class divide. The middle class is sinking closer and closer to the working class, and there is less spending dollars. That class matters for family structure. It matters for opportunity, going to college. It's important for income and wealth, and that inequality as it can from the rich to the poor is pretty significant as we look in place. I'm going to have you look at another video, very quick one, on the inequality of income within the country. Important things to consider as we look forward at what affects the family, and is it fair where people are at. So as you explore this, you're looking at those things. And then the final look at race and gender. As no surprise to you, there's growing racial diversity and immigration, that we're actually seeing the United States become more diverse. And it will be significantly as it come into place. And we can see the numbers here of those 40-year-olds, 40 to 44-year-olds born in the U.S., versus immigrant here, and we look at the difference of their background. There's growing racial diversity and immigration. The rates of assimilation and family patterns will continue to change. We'll see those emerging from the culture. We have a growing rate of intermarriage, and it's important. Remember when you planned a wedding? In class, they actually were assigned racial intermarriage or multiple different couples as they explore this. And it makes a difference in how we see society and the outcomes within it. And we have this issue coming into place of the unfinished revolution of gender and sexuality. And we see the inequality that remains entrenched, that women-headed households earn less money, have less available to them. And part of that is tied to, back to the chapter on work, is they are in jobs that pay less. Significant differences as shared work, and we see this view of the gender revolution, and even to the fact that men would prefer that traditional guidelines, and those gender ideologies must be looked at. It's not an automatic change in behavior just because society has said women should be all working, doesn't change those other things within the family. We've had so much to address within the family, things for you to think about within the process. And this chapter brings you to looking at what services are available out there, but it really doesn't tie everything quite together. You're going to be doing a lot of that as you start thinking about what happens within the family. So as you understand the inequality of wealth, hopefully you'll understand why services are so important. Families that are supported will significantly impact your future. Think about that as you are a student moving towards a career. If you're working with families that are supported and have the availability to have enough food on the table, to feed their child, to get through the service, the day-to-day with making sure they have safe child care, it only improves everyone's job, whether you're a teacher, a social worker, whether you're a bank teller, whether you're working in another field, that families need to be supported. So it's important things, and as you think about it, I hope that your discussion articles will focus on some of those issues of welfare, gender, and the inequality that occurs that affects family. Now, your first week, you will have your discussion board that will address your newspaper article. In the last week, I'd like you to close the class with a review of the Changing Family through a video that was created by PBS that goes over a 20-year period of interviewing this family and what they've affected. I know the video's long, but I won't be doing a second video for you at all. For some of you, you've fallen behind. You have one free discussion board you can miss, but I've included an extra credit discussion board here for you. You need only to post once by the due date and answer the question as it appears within the discussion board with by the closing date. The second part of the second week, you again only need one initial post due by the closing date. And that second piece asks you to talk about what you learned in this class, especially what you learned doing your research. So if you see the question, general review of what you learned sociologically from your research paper and how it ties to the course. So pretty much a thought within that. No need to post any comments on that as well. Your last quiz. Now I will be posting one more quiz as an extra credit type quiz as well. And that quiz will be over all the chapters, but a chance for you, if you missed a quiz, for it to fill that spot or replace the lowest grade you have. With that, thank you for the chance of doing this class. I'm recording this early. You'll be hearing from me more and hopefully with positive things as we move forward. But I look forward to having you perhaps in another class down the road. So have a great finals week.